Good evening, I'm Ger Colleran. It's the most controversial and hotly contested social issue of our time, abortion. And with the ink hardly dry in last year's Protection of Life in Pregnancy Act, it's again to the forefront, following the termination of pregnancy through caesarean section for a young refugee woman who had been raped. Now a leading obstetrician wants us to scrap entirely the 1983 constitutional amendment that guarantees the right to life of the unborn and start all over again. Tonight we ask, is it really time for another abortion referendum? The recent incident in which a young refugee woman had her pregnancy terminated via caesarean section has returned the issue of abortion to the top of the national agenda. Now the former master of Holles Street Hospital wants us to repeal the 8th Amendment to the Constitution, which provides for the equal right to life of the mother and the unborn child. Is this really necessary, or just another example of hard cases making bad law? I'm joined by Ruth Bowey from the organisation Termination for Medical Reasons, Dr. Peter Boylan, consultant obstetrician and former master of Holles Street Hospital, Caroline Simons, solicitor and legal advisor to the pro-life campaign, and Maura Nesta-Nigarlt, medical advisor for the organisation Every Life Counts, excuse me. But first, have a look at this.
Well, like, we always knew that as soon as we got married, we'd try. And I always wanted to have children. I was dying to meet the right person so I could start a family. We went for the private scan when I was just under 12 weeks. The lady was lovely. She was chatting away to us. Quite soon after she started scanning, she said, "I'm quite worried about the baby. There's something wrong with the head." So I was just floored. I couldn't believe it. It's just like you're... Sorry. You just never think it's going to happen to you. The report just said needs an urgent referral to rule out anencephaly. And I just fell apart then because I knew what that meant. And I just said, well, what do we do now? And he said, well, we'll continue to look after you. A lot of these babies, they can either die in utero or they'll die as soon as they're born. And then I said, well, what other choice do we have? And he says, well, if you don't want to continue the pregnancy, then we'll put you in touch with, people who can help you. And you can travel. There wasn't any question. Absolutely no question. There was no way I could continue for another 28 weeks, potentially, knowing that there was no baby. There was a baby at the end of it was going to survive. How could you go into work every day? And people saying to you, oh, when are you due? Are you getting big? Are you excited? Have you done the nursery? Have you bought the buggy? What do you say to them? Oh, well, there's no need to do a nursery because the baby won't be coming home. Appointment was made in a private abortion clinic in Birmingham. I've since learned that, other women have been able to go to specialist centres where they only deal with fetal abnormalities, like Liverpool Women's Hospital, and they're very used to dealing with Irish couples and couples with fatal conditions, and I suppose you get treated in a very dignified and respectful way. But I just unfortunately ended up in a private clinic. It was just horrific. Being on a plane with people who were going over there for business or shopping or holidays or whatever, and you're sitting on the plane and you're thinking, I don't know where I'm going. I just have this address in my handbag that I have to get the taxi driver to bring me to. I don't know what's going to happen. I'm away from my family. I'm away from my home. It felt like torture. And I felt like I was being treated like a criminal for our decision that we made that was right for us.
Ruth, I'm pleased to tell our viewers that you've had the gift of a little boy in the meantime. But how many women are affected with this condition annually, in your view?
With anencephaly or
yes, with fetal abnormalities?
We don't know. There doesn't seem to be very good statistics kept on how many people are affected. There aren't good statistics kept on how many people travel to the UK for terminations of these very wanted babies. But we have a support group, and we would get contacted by on average about one couple a week who are going through this. Liverpool Women's Hospital say they would see up to 2 Irish couples a week. At some stages it got up to 3 Irish couples a week, and that's one centre. People also go to abortion clinics. People also go to the Netherlands. So there aren't actually proper statistics kept, so we don't know how many people are travelling.
But we can assume, in fairness, that it's a multiple of the number of people that will contact you.
Oh, absolutely.
So
yes.
we're in our hundreds.
Yeah, absolutely.
Caroline Simons, how could anyone possibly object, in all fairness, in all humanity, to a termination being allowed in circumstances where the fetus will not survive, cannot survive?
Well, the first, sorry, excuse my voice, I'm afraid I have a dose of flu. The first thing I'd have to say is that there are no agreed definitions among the medical profession of what lethal malformations are, nor are there an agreed list of conditions which are considered to be lethal and incompatible with life beyond birth. There have been babies that have survived birth with anencephaly. I know of one that survived almost 2 years, I think in your own hospital, Peter. And so I can see what an appalling tragedy it is. I can understand, and nobody could look at the woman who we've just seen without feeling very upset for her. I mean, it's a dreadful thing to go through. But some of your viewers might remember last Christmas there was a story about a girl who went through a different experience, which the Sunday Independent published over a couple of weeks. And she was in America. She happened to be working there at the time with her husband. And she went the perinatal hospice route. And they interviewed her before she had had the baby and after the baby had died. It was a very different experience. So, the pro-life ethos is one that tries to look after both the mother, give her all of the support that she requires, and also to try and give her a comfortable and easy death with her baby, in as far as that's possible.
But Caroline, as well as advocating that, it also, in this context, in Irish context, it demands the legislative force to enforce that view on a woman in such circumstances, doesn't it? No,
because this is the normal way that mothers are looked after when they have a baby that has a condition that looks like it might not live very long after it's been born. Babies up to this have, the mothers and the babies have been looked after. The babies are born. The babies are given to the mothers, usually in the neonatal intensive care unit.
But you advocate for legislative bar on any intervention in such a pregnancy. Isn't that right?
I think you're presuming a lot there. I'm advocating for best medical practice.
No, and
you're incorrect, Ger, because there is no suggestion.
You're advocating that the medical or the legal prohibition on termination of such pregnancies continue.
I'm advocating that the best position in the interests of women and in the interests of unborn babies is that there be a right to life for both, and that the mother inevitably comes first, because you cannot fail to look after a mother without losing a baby as well. I think for people who are watching this who want to understand, how is it the pro-life movement can have a different view, I would suggest have a look at YouTube. And if you look under YouTube search engine for Elliot Hartman Mooney, 99 Balloons, you'll see there a very different position. And there are people in this country who are trying to get the perinatal hospice idea a little bit more broadly available. I'm sure, Peter, it must be part of your practice as an obstetrician.
Perinatal hospices are already part and parcel of what we do.
Yes.
And we've had two sort of varying approaches to the particular problem of babies who are very likely to die very soon after birth. And it's anomalous to very sick people in intensive care units. A baby in the womb is effectively in an intensive care unit. Its kidneys are not functioning, its lungs are not functioning. It's on a heart bypass machine, all done by the placenta. Now, when children are extremely sick, and we're talking about children here, in neonatal intensive care units, in Crumlin Hospital, in the Nash Maternity Hospital, Coombe, the Rotunda, all over the country, there are discussions going on with the parents as to whether or not the support, the life support for those children should be withdrawn and let them die in peace. Now, what you're doing when you're delivering a baby very prematurely with a congenital malformation from which it's going to die is that you are effectively removing the life support from that baby. Now, some mothers want to go on and do that at the end of the pregnancy or whenever they go into labour. Other mothers and other couples want to deliver the baby much earlier, and that's what we're talking about when we're talking about termination of pregnancy. those babies are just as loved as the ones who go on to term.
But in this country, the regime is that that cannot be done.
No, it cannot be done. No, it's illegal.
But also, it's a movement, Gerard, when you think about it. It's a movement away from the nurturing and caring.
No, it's not. It's an all-encompassing, allowing all different points of
let
view
me rephrase
to,
then, Peter. You know, up to this point, obstetricians have delivered babies, and they have done the best they could for the baby when it's born, at whatever stage it's born at, and in whatever condition it's in. This would be very different. This is something that would require doctors to deliver babies at a time, knowing you can't say for certain that a baby is not going to survive to birth.
Caroline, I had 5 scans by 5 different people. I had multiple opinions. I had diagnostic tests from fetal medicine experts, and they could tell me that my baby was not going to survive. And Caroline, I just want to take this point, because I've listened to you a lot on this topic, and I just want to take this opportunity to say this. We support women who wish to continue with the pregnancy, and they should be given the best care. But in Ireland, they are respected, their choice is respected. In Ireland, our choice is not respected. We are forced out of our country.
I'd like to bring you in here. What is your objection to the treatment, the termination of such a pregnancy where there is absolutely no chance of survival?
As a GP dealing with parents of children with seriously ill children, children who have fatal conditions, it isn't all that different to pregnant women who've been told they have a baby who is potentially not going to survive the perinatal period. My attitude dealing with a patient like this is that I want to do for them what is ultimately in their best interest.
Yes, I know that.
And I want the parents, the mother and the family, the father and the children to come away from that position where they have been bereaved with the least amount of hurt.
But what was in my best interests for my baby and for my family was having a termination. I was 12 weeks pregnant. I would have had to go to work for 28 weeks, growing a little baby inside me that was never going to survive. And that's exactly what it is. It should be what is in the best interests for that individual.
Well, generally when I see people who come to me pregnant with this diagnosis, they are very, very upset, right?
Absolutely.
They very often have they don't really know which way to turn. Sometimes...
But the point is, Maura, that you require, or you seek legislative force to make sure that this termination cannot legally take place.
No, I don't seek that. I'm just quite happy.
Advocate that.
Sorry, I'm quite happy with the 8th Amendment, which gives equal rights.
Which disallows it.
Which gives equal right to the baby.
But how can you give equal right to my life and my mental health to a 12-week-old fetus with half a head and half a brain? How can you give equal right to that? It does not make sense.
I'm sorry. You know, I am going to be the person who will judge the value of a human being depending on whether
we'll have more
IQ is impaired.
We will have more discussion. No, just a moment, please. We will have more discussion along with a preview of tomorrow morning's newspapers after this break. I'm discussing the contentious issue of abortion with our panel, Ruth Bowey, from the organisation Termination for Medical Reasons, Dr. Peter Boylan, former master of the National Maternity Hospital, Holles Street, Caroline Simons, solicitor and legal advisor to the pro-life campaign, and Maura Nassini-Garrett, medical advisor for the organisation Every Life Counts. Now, I cut off Maura as she was making a point, so I'll allow her to get back in there.
Okay, as a GP, and I deal with people in bereaved situations a lot, I try to do for them what I believe to be in their best interest. I try to provide the best medical practice for them. I don't advocate abortion because it in itself is associated with significant serious psychological sequelae. You're asking people who are already traumatized to undergo a further trauma. And I'm not saying everybody is going to be traumatized by it, but there is a significant number who do. It's certainly, the statistics in the United States, there are two studies actually in the United
Maura,
States.
I just want to move on to Peter Boylan. You've really opened up another can of worms on this one, haven't you? I mean, we've been through trauma in this country since 1983 amendment several times. And in the Sunday Business Post article, you're asking for that debate to be reopened again. Essentially, the amendment scrapped, and let's have a get-go position.
Well, the amendment, no woman of reproductive age in this country was able to vote on that amendment. Time has moved on and attitudes have changed, as various surveys have shown. about 80% of people in this country would be in favour of allowing termination of pregnancy for fetal anomalies such as Ruth has been talking about.
And rape
close
and
to
incest.
rape and incest and severe maternal health as well. And our constitution is incredibly contradictory and grossly hypocritical. On the one hand, we have the constitutional ban on termination of pregnancy. On the other hand, we have the constitutional protection of women and couples with the ability to, in their ability to seek information and to travel specifically for termination of pregnancy abroad. Our constitution protects those women. And that's an absolutely
can I ask you straight up,
crassly
Peter,
hypocritical situation.
would you like the English-Welsh termination of pregnancy regime
No,
to exist in this country?
No, I wouldn't. And I don't think that that's what the middle ground in this country are seeking. And I think we need to respect each other's points of view. But there appears to me, and I've spent 40 years dealing with pregnant women here in the United States and in the UK, in London, in fact. And there is a middle ground in this country, which seems to me, and in my experience from dealing with all these women in similar situations to Ruth, some women want to continue with the pregnancy and they are to be supported, and others don't, and they are to be supported
But I
also.
suppose, Peter, the middle ground also in this country believes that once it's in place, it'll be impossible to stop the dam, and we will, in effect, have a regime that they have in England and Wales.
Well, no, we need to trust women. And for example, there has not been a flood of women saying they're going to be suicidal and want to have a termination of pregnancy on that basis. We need to grow up as a country, confront the issues. We may have to confront the issues if the UK closes down to Irish women, because they're quite frankly fed up with our situation, our hypocritical situation, where the high proportion of women, everybody in this country knows somebody.
Is that not scaremongering? And that
no, it's not.
A chance that will happen.
It's a very high chance it will happen. The UK NHS is under an awful lot of pressure, financial pressure. They have waiting lists. So if a woman phones Liverpool or Birmingham or wherever, she's told, we can fit you in, but it'll be 3 or 4 weeks' time.
What do you say to
Irish women don't go to the NHS.
I'll come to you more.
Irish women with fetal abnormalities.
Just a moment, Peter.
do.
What do you say to the stats? Even a cursory analysis of the stats suggests that we have in England and Wales, per population, per capita, 1 abortion per 280 people. Even on the figures, and even being generous with 6,000 abortions from the Republic, we're talking about 1 per 750. The very fact of having, in the crude maths that may be applied to this argument, the very fact that we have the regime we have has dampened down that stat in terms of per capita for Ireland.
Yeah, exactly, because the women who can't afford to travel and those who are in the care of the state can't go and so on. So it does certainly dampen down. But I think what we're talking about there is really what you might call social abortion, which is not what anybody is advocating at all. What we're advocating is that there should be a choice for women who have serious problems like congenital malformations, where the baby's going to die, rape and incest and so on, that they have a choice as to whether or not, and the figures from the Rape Crisis Centre are very interesting. Of the 4,000 women who went to that centre,
but before going to Caroline, you must recognise that there is absolutely no political...
And one had a termination.
There is no political will for this.
Well, our politicians really need to face up to their responsibilities, which are to legislate. That's what they're paid for. We're paying their salaries. We're paying their income and so on. But they need to do the job they're paid to do.
Peter, can I ask you a question?
Yes.
Would you do an abortion for a baby that had a fatal fetal abnormality?
Yes.
What fatal fetal abnormalities would you do abortions for?
I'm not going to get into that, Karen. I'm not going to get into the specifics of that
Okay, well,
sort of thing,
can I just say, because I think it's worth getting out there, that the British Journal of Obstetrics and Gynecology did a full review in 2012 called Fatally Flawed. And the authors of that report said there is no agreed definition of any complication that is fatally flawed, and nor is there a list of conditions. Because, may I finish making the point there? My point is simply this. Once again, we're moving, and once again, Peter is advocating that medical practice in relation to the care of women in these situations moves away from evidence-based medicine.
No,
we've introduced abortion.
We've introduced
abortion on the basis of no. May I finish my point? I want to clarify.
Do not tell me I'm moving away from evidence-based medicine.
I, as you did, attended the Oropsis hearings last year, and all of the psychiatrists, bar none, made it very clear that abortion is not a treatment for suicidality, that they do not prescribe abortion for suicidality, and that it is, and Professor O'Keefe put it in inverted commas, a treatment a woman chooses for herself. Now we come to a situation where you appear to be advocating that abortion is allowed for diagnoses which are not conclusive, for which there is no agreed definition in the
Caroline,
profession,
you trust the
and where there is no
experts?
list of
Just
conditions.
1 second.
that
Caroline,
fulfill the
you seem to be looking for
definition.
mathematical certainty.
No, I'm not.
In life.
I'm looking for best medical practice,
okay,
Jared.
and
And we're
another
moving
thing-
away from that. It's
another thing-
becoming a political,
I just want to
service-oriented
just broaden it out a small
profession.
bit. Where a woman is raped and she's expected to have her body act as a host after an act of violence, how can that be sustained, do you think?
Like in the C case.
No,
Yes, actually, that's
Yes,
a very good
like
point.
in the C case.
Yes.
Don't go
Where
down
the
I'd like to defer to you. They do go to that.
HSE went, well, we are going to go there.
Yes, that's a
Because
very
in the
good
C
point.
case, the HSE went against the parents who, being travellers, knew very well what the culture was that child was part of.
I
And
don't
they
think
brought
it's-
that child
I
to
don't think it's
the
at all
United
fair.
Kingdom.
We're talking about a generalised issue where a woman is
Well,
raped and
sorry,
the victim
excuse me,
of
if I
abuse.
remember correctly, Peter Boylan referred to a specific case in his article the other day about a refugee. So I think that it's quite in order for me to refer to the C case in that instance.
But not to give her back.
Same level. We work on a level.
But Caroline,
Sure.
could you answer
This is in
that
the public domain.
question? The question I put to you was: a woman is raped, her body is then required to be used as a host.
That's a terrible expression, Jared.
But is that not the case?
It's the perception that's being put abroad that that is all that pregnant women are in all situations now, merely hosts when they may or may not
please,
choose to be.
please.
It's a terrible expression. How can you insult women by describing them in that way, as hosts for the babies that they're
How
carrying?
can you insult women by determining for them what their decision is?
No,
The
Peter, that's
arrogance
not
of
medical.
this- no,
It's
the
arrogant
arrogance
of you
this-
to pretend this is
No,
a
no, no.
medical
Just one at a time.
criterion, when in
Um,
fact what you're proposing is highly political
Peter.
and highly politicised.
I think it's terribly arrogant for people to take an absolutist stance and make judgments on other people and tell them this is what you're going to do and I'm right and you're wrong.
That's what your
And
article
that's
did.
what...
Populist,
No,
Peter.
no.
You're in danger of being described as a
It's what you
populist.
guys are doing, unfortunately.
No,
trying
you're
to
saying you do abortion.
show your ideology.
Moranasnigal.
Well, I read your article for the first time actually today, and I was quite amazed at, I mean, I actually worked in Holles Street when you were a non-consultant hospital doctor there, and as far as I can see, you were a regular doctor, and now you're some sort of
No,
political
hold on a second.
animal.
No, Ruth, you wanted to get in. You wanted to get in there.
make a point. You know, you talk
Pussy
about the
cat,
C case, the D case, the A case. I am Ruth. I did the best I could in my situation. I did what was best for me. There's Amanda, there's Arlette, there's Gay. We're not A, B, C, Ds. We're actually women who have gone through a very, very traumatic thing, and we should be cared for in our own country and given the compassion and dignified care that we deserve.
But Peter, there is that real concern among the middle ground that
yes.
a relaxing of the rules will lead to an escalation of the kind that we've seen in Britain, where children with mental and physical incapacities identified in fetus are aborted. I mean,
That's a genuine fear,
Yes.
which has to be recognised and has to be confronted. But that's
but
the
how
sort
does
of
one
thing
confront that?
by dealing with it in legislation, not in the Constitution.
must be-
It's the wrong place.
Caroline,
Not
yes.
You can abort
no.
a baby up to birth under the English legislation if there is something wrong mentally or physically with the baby. That has in the past
We're
included
not the
clubfoot.
UK, and
We're
that's
not
not
the
what
UK,
anybody is
exactly.
advocating.
How are we so different from
No.
every other jurisdiction that
I
has allowed it
actually
in on any
have the
basis?
figures
No,
for
that's not-
2012
So
from
do I.
the United States.
89,000.
Moranasnigal.
Well, just for, apropos the Irish figures, 47 women in 2012, 47 Irish women in 2012 had abortions under grounds E, which is for fatal fetal
In
anomalies.
hospitals, not in clinics. No, you're not including people who went to
Can
clinics.
I just finish
You're not
my
including
point,
people who went to other
Yeah.
countries.
Ruth,
Yeah,
my
finish your
point
point.
is this, is that of the 47 who had it under those grounds, 23 of them had them because their babies had Down syndrome.
But
That is
meanwhile,
not a fatal fetal anomaly.
Peter, we
We're not
have
talking about
1,200 women
Well, we are
each year
talking about it.
going
Well,
from
we're not
Dublin,
talking about it.
taking that trip to Britain.
Yeah.
And we have perhaps up to 6,000 in total, because I'm sure a lot of them don't give their
Fourth.
home
that's
address.
right. Yeah.
Yes, but I mean, okay, well, it's 4,000 registered this for 13. Do you have any hope that in the short term that travel will stop and the services will be provided here?
No, the vast majority of those terminations are done in private clinics, which have nothing to do with the subject that we're talking about here. And they're not what we should be concerned about in this context. What we're talking about people like Ruth and families like that, couples like that who find themselves in extremely difficult situations, having to travel, having to bring home the body in the boot of a car, not being able to grieve for the child, not being able to acknowledge it publicly in Irish society because of the basically the ideological stuff that's thrown at them. And that needs to change. We need to face up to these problems as a mature country. Take this out of the Constitution and deal with it through legislation, and deal with it with reflecting the opinions of women in the reproductive age groups in Ireland in 2014 and onwards. And legislation can change, but changing the Constitution is a terribly blunt instrument.
I want
the
to make a
Constitution
point.
should deal with broad principles rather than specific prescriptive
Yes,
I want to
Maura,
make a point
briefly.
here. I'm here representing, I'm a GP, but I am here representing every life counts, okay? And I have spoken to those mothers. I'm sure you have spoken to them as well. And they have said that they were made to feel ashamed of the fact that they did not want to have an abortion. They felt pressurized into, pushed that way, and they said the worst culprits were the consultants, not the nursing staff or the other ancillary staff, but the consultants in this.
That's not my experience.
Well, may not be, Peter. I am talking about the women that with whom
I know,
I've had.
it's in fairness, Maura,
And can
it's
I
a
just make
very
one other
broad
point?
brush
I just want to
accusation.
make one final
I'm afraid
point.
we'll have, I'm sorry, but we'll have to leave it
That's
there.
where hospice care has been
excuse me.
available. People have opted for that in
Maura,
preference
please,
to abortion.
I have to leave it there now. I know it's a very time-limited situation. I'd like to thank the panel for their contribution.